sad. Where I met a guy in Provincetown. He was my age. He was blonde. He had the most beautiful blue eyes, and beautiful body, and so kind. And he told me he had HIV, and I was so sad, and I was terrified, and I thanked him, and I just felt so appreciative and grateful that he told me that, and he told me in such a open way. And then this was before we had sex, and then I wouldn't kiss him. I wasn't comfortable kissing him. And I kind of like held him while he jerked off. And I'll be graphic, but he came, right? And I looked at his cum, and I like went back like this. Like I thought that the cum was poison. And 10 years later, when I was diagnosed with HIV, I brought that with me. That was still the way that I looked at HIV. And even though at the time I knew there was medications to keep me alive, I didn't care about staying alive because I thought, who is gonna love me? I'm gonna be rejected like I rejected him, and I'm gonna be infectious for the rest of my life. And love is the greatest thing for life, right? We want to love and be loved, like in Moulin Rouge. So I got very depressed, and I decided not to love. And then 9 years later, my doctor told me when I came in with a trick, when a condom broke, he said, don't worry about it. He doesn't need to take PEP. You take this after potential exposure to HIV. So he doesn't need to do that because it's impossible. You couldn't give him HIV. You're undetectable. And this was 2012. And I said, are you kidding me? Like I said, will you put that in writing? And he said, no, I won't put it in writing, but anybody you want to date or have sex with, if you want to come in, I will let them know. You don't need to worry. So that started to change my life. Not right away, because I couldn't believe that was really true. And nothing that I read was confirming that. There was a Swiss statement in 2008 that was widely discredited. There was another statement that I found, but it never got circulated. But everything, do you know what the US CDC is? Have you heard of the CDC? Well, it's like a very conservative health prevention department in the United States that has an impact all over the world. And people in the United States go there for information about HIV prevention, and people say, no, it's a reduced risk. And I'd say, no, there's no risk. My doctor told me. And I was like, I'm going crazy because I can't find anything, and I trust my doctor. So what we're also finding is that, doctors were telling people based on their, through the lens of prejudice and racism and classism. So I was told, because I'm a white guy, I have health insurance, I'm very, very privileged. But I would talk to heads of clinics, and they would actually say to me, we know U equals U is true, but we kind of tell people selectively on a one-on-one basis. I was like, are you kidding me? You tell some people, or, and I said, why? And a clinic in Washington, D.C., head of a clinic said to me and my colleague, if we tell people with HIV that they can't transmit HIV when they're on effective treatment, then they're gonna stop using condoms. It gives them a license to have condomless sex. And there's already a rise of other STIs, and we don't want that to happen, so essentially we lie to them. And I was like, do we need a license to have condomless sex? Like, where can I get one then? And who gives you permission to decide for us, for our bodies, what kind of information we get? STIs are separate from whether or not a person who's undetectable can or cannot transmit HIV. The other thing that they were telling us, that I heard actually from the CDC, and I love the CDC, people were just being honest there, they said something called the unsophisticated consumer. So if on an individual basis, you're smart, so I'll tell you, and you're smart, but you may not be so smart, I'm not gonna tell you, and you're not. And on a public health scale, on a global scale, look, how many people are gonna be so stupid they won't understand it? I'm saying it in very crass ways, but they're saying some people won't be sophisticated enough to understand it, so we don't let this out on a large scale. That's a massive human rights abuse. That's like a massive, incredibly damaging human rights abuse, to be telling people they're infectious when they're not. I mean, this is interfering with the most intimate moments of our lives, our ability to love another human being, to have sex with another human being, to conceive children without artificial and expensive means of insemination. We can do all that, but we were being told we couldn't. And it was being withheld deliberately in many, many places. So, what we did, we felt that this is everyone living with HIV has a right to accurate information about our sexual, social, and emotional health, reproductive health. So we went to the researchers from these major studies that were actually proving U equals U. There was a whole groundswell of research that proved it, but no one was making a statement on all of this. So we said to the researchers, your science isn't getting out to the public. Like, these researchers are telling their individual patients, you can't pass it on. You can have sex without condoms, your partner doesn't need PrEP. You can have a baby naturally, don't worry about it. They didn't know that that's not getting out to the rest of the world. So what they did was something incredible. The researchers worked with us on a statement, a consensus statement, to confirm U equals U is indeed true. We issued that statement in July 2016, and we put together an advocacy video with the voices of people living with HIV demanding that all of us have this information, not just privileged people like me, but all of us have this information. And the idea was to take that document, that consensus statement, the video, and our voices to go out and change the narrative about our bodies. So the plan was to recruit influential people and organizations to sign on to this campaign and confirm what we knew was true. Our first target was the CDC, was the US federal health departments, because of the influence that they had. So at the time when we launched the statement, we sat down with them and we said, we know you know this is true. We know you know this is true. And you have to tell people that they're not infectious. This will change our lives. It actually affects the entire epidemic because it's changing what it means to live with HIV. It reduces anxiety associated with testing. More people will go on treatment and stay on treatment because there's an added incentive to go on treatment. That reduces new transmissions and brings us closer to ending the epidemic. There's so many reasons. So over the course of the year, we had very intense conversations with the federal health departments. There was a core group of us talking to them and pushing, and it was intense. There was some yelling, me, and there was some swearing, me, once, and I apologized, but it was a very productive conversation that ultimately changed the course of the epidemic. A year later, they changed the messaging from a reduced risk to effectively no risk, which means in effect no risk. So that was wonderful, but during that time it was really hard. As Randy knows, we were getting fought from every single direction, not just from conservative research associations who didn't want the message out, but even from our own community. People living with HIV were pushing back, they didn't want this message out. The internalized stigma in the community is so strong, it's so pervasive that people couldn't let go of feeling dangerous. It was really fascinating. There's a documentary on it now and on the whole movement itself. But it was victorious. I mean, as soon as we issued that statement, New York City signed on and ignited the movement. About 6 months later, do folks have you heard of Katie in Canada? Yep. Yes. A major research resource organization signed on, and then it just kind of exploded in Canada because you're all so nice. All these Canadian organizations started signing on, and then it went global. Really, because of social media, it's now we now have almost 1,000 partners, official partners.